Hi, my name is Dr. Tariq Kareem. I'm an American board certified consultant in internal medicine, and currently I'm working in Ajman, UAE. A bulk of my patients belong to the diabetes group, and while treating these patients, I have realized that there are a lot of misconceptions about the diabetes, and because of those misconceptions, patients are not very compliant with their medications or they take it wrongly. So I have made this series of lectures or video presentations on diabetes. So I will start with the video on understanding the diabetes. Once you understand the diabetes, it is much more easy for the patient to follow the doctor's instructions and his medications. Let me make one thing clear. There is no miracle cure for diabetes. Diabetes is a lifelong condition and it needs a lifelong commitment and follow up for this condition. So let us start with understanding diabetes and then we'll take it further. Thank you. Let us start from the beginning. We start from the intake of the food. Now, the food we take has three types in it. One is carbohydrates, second is proteins, and the third is fats. The diabetes is concerned mostly with the carbohydrates, that is glucose, starches, fructose. All these things, carbohydrates, they get broken down to the simple monosaccharides, sugars, and they get absorbed from your intestine. Once they get absorbed from the intestine, this goes to the blood in the form of glucose. When the glucose goes in the blood, the level of glucose increases in the blood. Once the level of glucose starts increasing in the blood, the pancreas, which is attached to the GI system and it's an organ inside your stomach, starts releasing insulin in response to this glucose increase. Now, when the glucose level increases in the blood from the intestine absorption, it gives signal to the pancreas. The pancreas has special cells called beta islet cells, and these cells, in response to the high glucose level, release insulin. It is released in two stages, one the rapid phase and the slower phase, but the insulin is released. This insulin goes along with glucose, goes from the blood to the fluid which is surrounding the cells of the body. Cells is the basic unit, a cell is a basic unit of human body. This is the place where energy is produced, where the proteins are synthesized, nucleic acids are synthesized, the structures are maintained, and it is like a kitchen. In this kitchen, the stove is your organelle called mitochondria. Mitochondria takes this glucose and burns it into energy, and energy is used to keep the body metabolic rate and also synthesize different proteins through various mechanisms. Now, for this glucose to go inside the cell, each cell has a mechanism of lock and a door. The lock is where the insulin acts. Insulin goes, attaches it to the lock, which is called the insulin receptor, and this key goes into the lock and opens the lock. When the lock is open, then the door gets opened, which is called the glut receptor or the glucose transport receptor. When the glut receptor opens, this glucose moves inside the cells. When the glucose moves inside the cells, the level of glucose in the blood comes down. And this glucose then goes into the mitochondria and starts its functions. So the body cells become rich in the fuel to do their job, and they are working at their optimal capacity. Now, this is where the diabetes comes in. What happens is we have two types of diabetes. One type of diabetes is called type 1 diabetes. Two major types, I mean. Type 1 diabetes is when the keys are missing. I mean, the insulin is missing. And insulin is missing because the beta islet cells in the pancreas get totally destroyed. And it usually happens in the juveniles, in the young patients. And what happens is, due to an autoimmune reaction to some unknown infection, most probably viral infection, all the beta cells get destroyed. And there is no key to fit into the locks, doors never open, and the patient gets a most severe type of diabetes, which is called type 1 diabetes, and there is no treatment except giving them insulin. Although there are now new monoclonal antibodies and the vaccine in discussion, but this is the current state of affairs. Now we've got type 2 diabetes. Type 2 diabetes has got to do with the door. Now, this type 2 diabetes has got to do with the door. What happens is, it's just like the door gets old and difficult to open, and like there is rust there, the difficulty in opening the door. So what happens is that the insulin in the given dose is not working to open the door. So for this purpose, there starts a stage of hyperinsulinemia, which is also called the insulin resistance phase. And during this phase, pancreas starts overproducing the insulin. And when this insulin is overproduced, this causes a state of hyperinsulinemia, which has got its own bad effects. And these own bad effects are like, these patients have got start developing thickness of their vessels. There is atherosclerosis starts to happen, that is thickness of the vessels and the accumulation of fat in the vessels. And then what happens is, slowly, just like the pancreas keeps getting stimulated, and then it reaches a static state, and then its level starts dropping. Now, with this rusted doors and dropping level of insulin, you start with the state of pre-diabetes, and then pre-diabetes, in which there are some impaired values you get, but it's still less than the threshold level to define diabetes. Then sometimes what happens is, because of some acute severe infection or severe stress, the diabetes shows up. You manifest as diabetes, then the stress factor goes away and it comes back again to normal. So you sometimes think the patient is cured, but he's not cured. He's just going through that phase. After that, eventually comes the time then pancreas becomes more and more destroyed. And then the level of insulin as compared to the sugar level starts to drop. And as it starts to drop and the glucose is not able to go inside, the hyperglycemia develops. And when the hyperglycemia develops, sometimes it starts, you do with the single medicine, you can help it, but then you keep on increasing the medicines and the pancreas keeps getting destroyed until a time comes when there is absolute need for insulin. Patient will not manage without insulin. So this is from type 2, it gets into like a type 1 situation of a insulin deficiency. And these patients can have manifestations of type 1 diabetes. Now, what is the effect of this thing that glucose is unable to go inside? When the glucose is not able to go inside, the level of glucose in the blood around the cells starts getting higher and higher and higher. And the blood and the extracellular fluid is very high in sugars, and as compared to that, inside the cells, the sugar is not available to do the mechanism. So what happens as a result is that the cells are starving inside. The person is getting tired, he's confused, he has got a sense of not well-being, and on top of that, there is another thing, the glucose level which is getting higher and higher goes inside the brain, because the body has to stay at a certain concentration. It cannot work with a very thick blood. So when the signal reaches the brain that the blood is getting thicker and thicker, it has got receptors which are called osmoreceptors. These osmoreceptors, when they see that their glucose is high and blood has become thickened like a syrup, So it sends a signal to the other center, the thirst center in the brain, and this thirst center makes the person thirsty. So this person is tired and he's thirsty and he starts drinking water, more and more water. When he drinks more and more water, then this water goes through the blood, makes this sugar levels come down, to make the blood thinner from the syrupy consistency, and then this reaches the kidney. Kidney is the only defense mechanism once the pancreas has failed, which brings the sugar down. So what happens is this: when the high sugar blood reaches the kidneys, when they reach above a threshold level of 180 usually, the patient starts peeing, making urine, a lot of urine, and this urine has got a very high concentration of sugar, and this is how it is getting rid of the sugar. So these patients, they have got a lot of thirst, and they're peeing a lot, and they're very tired, starved, they crave for sugars, and they're hungry. And this is how the manifestations of the diabetes take place. Now we will go to the second phase of what happens as a consequence of these features to the body.